Hi, my name is Claudine Lewis. I'm a respiratory therapy student, and I'm going to go over some mechanical ventilation with y'all as I fall. So this is the Draeger Avita XL. The actual on switch is in the back, so that it can't accidentally be turned off. That would be terrible. And when it starts up, there's going to be a lot of beeping. It's not happy about it. So it's going to go through its test mode and make sure it's good to go. And I probably won't do this on every video, mostly because the beeping is really annoying. So let's say new patient. Oh, look, previous patient. That would be me. Let's do a new patient. Ideal body weight 75. Let's change that. It's much lower. Let's do 55 and give me a little room. So accept that. It's an adult patient. Fantastic. We're in SIMV. Start. We're going to start SIMV mode. Perfect. So, with me putting in that information, it's got a tidal volume of 380, inspiratory time of 1 to 1. Wait a minute. 1.1, I'm sorry. I to E is, stop beeping at me. I to E is 1 to 3. PEEP is 5, pressure support is 5. Let's say I want to change the PEEP. Let's go up to 10. Now let's do 8. I just push the button on the screen and then make the yellow, the knob has yellow around it, and it helps change that. So I'm in SIMV now. Let's say I want to go to PCV. Let's go to pressure control. So we have pressure control. Initiate that. None of the settings change, which is awesome. So with this, I've got a resistance of, on my test line, it's very compliant. Compliance is around 60. Resistance is 12. It's going to get very upset in just a second. Frequency is 14. Minute ventilation is 6. I did not notice there for a second there. Fantastic. So let's say my patient needs some suctioning. I really wish I could do this better. So this would be in line. This would be already hooked up to my suction. They have found that there's less risk of infection by just leaving these. So I have the hardest time holding it, jamming it down in the tube. Oh crap. It's not going to go down the tube. Why isn't it going? There we go. So we shove that down in there, squeeze and pull. Your patients will cough just like any time you suction, generally speaking. So if we want a lavage, we can use this little port right here and one of the little red bullets to squirt maybe 1 cc down in their lungs and help loosen it up so we can suction it out, or to help cleanse our suctioning, just because they get really nasty and gunky. I like the word gunky. It's better than boogery, I guess. So let's say we wanted to give the patient a breathing treatment. The Draeger has the option of doing it in line with the machine itself without having to use a flow meter. So you would hook the oxygen into this little teeny tiny port. It's the only one between the inhalation and exhalation ports. So nebulizer, hit the big button again because it's yellow. So, and I don't know if you can hear that extra. I could put some saline in here so it's easier to hear. All right, we've turned that off. So let's say I wanted to do an MDI. We have our little corrugated spacer in our tubing. We would want to take any filters off, or not have it in there, have it behind the where the spacer's at. It's got a little tiny port. You would shake up your inhaler, warm it up like you would any other time before you give an inhaler. Take the canister out, squirt it into that port, do an inspiratory hold for a couple seconds. Give it like a minute or two, do it again, do your inspiratory hold. That would work. So we're on pressure control. Perfect. Let's say after all of the suctioning and breathing treatment and shenanigans, that they need a little oral care. I have my little baby. I'm going to move you down so you can see the baby and not me. So we have a little toothbrush guy that will be hooked to suction. So let's say we start off on the left side of the face. We would clean in there really well with suction on. Don't really want to add any liquids, which we could just suction right back out. So we'll do that. And then we'll move this to the other side, to this side. I need to buy myself more than 2 minutes with that alarm. So we also have the option of swabs, which really don't do anything except for maybe moisten the lips. They're not helpful as far as getting anything actually off the teeth. I also have little suction canisters to go around, suction canisters, suction cannulas to go around the ET tube. They do move the ET tube very often to make sure that they don't develop pressure sores in their mouth. Also want to make sure that it's at the same place that you left it, which this one's at 12, so that you don't shove it in or pull it out. It would be secured with a very nice ET tube that has a little thing you pull, and you can just slide it back and forth without having to worry about possibly pulling it out. So I think that's it. Thank you.